You're listening to ASOTU CON Sessions by Space Auto, recorded live at ASOTU CON 2025.
Alrighty, so we're live here on the ASOTU CON podcast stage powered by Space Auto. And in the heart of the action at ASOTU CON, right in the middle of 2025. I'm Zac Kinch, and today I'm here with Keith Lemer, and we're talking turning health costs into culture wins. So, Keith, thanks for being here. We're excited.
Thanks for having me, Zach.
So far this morning, we've heard culture. I'm excited to get right in there, and I think there's no better question than start right away with healthcare. What's it actually for? I mean, I get health, but like when we look at it as a business, why is it important?
It's a great question, and if you look at healthcare, I think what it really provides is the glue, the culture of an organization, right? Yeah. People leave companies for poor healthcare choices, right? For poor healthcare plans, and because most people have issues, right? They have challenges with their health insurance. They want a quality, a high engaged health plan, right? High advocacy and low cost, and they rarely get that from most organizations. So they're looking high and low for that.
Yeah, and I think, to your point, I think it's amazing what you just said. You know, when you start interviewing, healthcare is not the initial topic. But the number of applicants I've had come to a complete stop when it gets ready, like, hey, we love everything. Can we see your healthcare program? Oh, we're not going to be able to cross the finish line. Why do you think this industry is so reactive versus proactive?
It's interesting. Everybody says the healthcare system is broken, Zach.
Yeah.
It's not broken. It works just fine for those that designed it to keep the revenue streams intact. And so if you can figure out a way to provide a lower cost, more engaged plan, high quality, right, you've cracked the code. And what most people don't realize, right, claims drive premium. If you can lower the cost of the claims, you can lower the cost of the premium, thus lowering the cost of the contributions for the plan. But most health insurance companies, right, the traditional ones, don't want to do that, right? The more you spend, the more you make. And those entities that surround the plan, the more you spend, the more you make as well.
So what would you say the biggest misnomer is in the healthcare industry?
I'd say the biggest misnomer about the healthcare industry is that in any market, right, whether it's here in the Baltimore area or Dallas, Texas, or Miami, Florida, every doctor charges a different price for the exact same procedure. And if you can figure out a way who's high quality and low cost, you can guide and advise people to go to those lower cost procedures. So as an example, right, a health system down the road from another health system, same doctor has ability to do surgeries at the same place. Yeah. A knee surgery could be $80,000 at one facility and $20,000 at the other facility. If you can figure out a way to incentivize that member to go to that lower cost, higher quality, you've saved the company money, and thus maybe the employer, right, the car dealer, will waive the deductible or the copay for that employee. So it's a win-win.
Well, I got to ask about that because you mentioned win-win, and it sounds like creative healthcare essentially. Kind of walk me through some of the things that you've done. Like I've heard these rumors of your company and what you kind of are doing with healthcare. What's some of the things you've seen that is creative to be cost effective for not only the business, but obviously the employee as well?
It's interesting, right? We go into most groups, right? These are not healthcare conversations we're having. Their culture, their business improvement, their retention, their finding good talent. And so when we go into these companies, right, we take them, they're either fully insured, paying premium, or they're self-funded already. And we say to them, listen, there's opportunities, probably 30 different strategies to go in and remove waste, fraud, and efficiency, whether it's getting an $80,000 drug for $40,000, doing dialysis carve-out PPO as an example, that the original cost may be $175,000 and you get it for $50,000. Most carriers simply see the claim in, auto-adjudicate it, and immediately pay it. And what we've been able to do for many dealers like Carter Myers and Oarsman and Lindsay and Belize is go in and say, wait a minute, let's take a look at the claims, let's educate, let's advocate for the members, and ultimately saving these dealers millions of dollars. So much so, and I'll use Carter Myers as an example, for the past 2 years in a row, they've waived employee contributions for 3 months in a row, basically saying, you, Mr. or Mrs. Employee, no need to pay your employee share. That's almost $3,000 back in their pocket. That is a massive opportunity for culture enhancement.
Yeah, you just think about that. I mean, anytime that you're able to put money back in employees' hands, especially when it's unexpected, right? It's different when it's expected. Hey, I worked hard, I earned this. When it's something like that, it changes the culture of the company. I got to ask on that side of it, because again, you guys have been really unique in that journey with Carter Meyer. I hear about sick day sharing and people being able to do these. what benefit did that give, to the culture? But also on the first part, what did you guys see as kind of selling that as a new culture?
It's interesting. Everybody says healthcare costs can't be managed, and we look at it as the number one negotiable operating expense that can be managed. And in return, what does that do to the culture? It improves the retention of the employee. It improves recommendations in terms of new hires at an organization. It's folks that are there already recommending to their friends and other industry associates, come work for my employer. And so it reduces turnover, and then thus it improves engagement, reduces sick days. It has a massive benefit where it's not just an expense line item as most organizations look at.
Yeah, and I think that exactly what you just said there is when you start looking at it as an expense line item, I think you take the human element out of it. And I think we immediately go back to dollars and cents instead of the culture. And I love how kind of things have been paraphrased today in that side of it. So, how does a well-managed healthcare environment look today versus what you see it looking in 10 years?
Yeah, a well-managed healthcare environment today is running at 20 to 30% below what other organizations are actually spending. When it's not managed, and maybe going 10 years out is too far, maybe 4 years out, those costs will double. And so a lot of companies that are here today, right, they rely on a broker consultant. They put on 4 vendors on a spreadsheet, right, United, Aetna, Cigna, Blue Cross. They get a 10 or a 20% increase, and they set it and forget it. When you're working with a strategic advisor, somebody that understands data, analytics, efficiency, and culture, right? That's the key word, culture. You have these organizations that are really bringing proper solutions to the table that help really become a strategic partner to the business. And that's not everybody that's out there, but there are a few select agency firms that are here today, frankly, representing those types of solutions that work and that are using it to gain great partnership with their dealers.
I think that's what I love about ASOTU CON, is that it's got the like-minded individuals that are in a building, and then it's like, whatever happens next happens. Welcome to it. Who knows how long it's going to be there? Is this the first year attending, or how many years have you been here?
So this is my 3rd year at ASOTU CON, and I'll tell you this, every year it gets better, and the one thing that I like about ASOTU CON, it's like the unconference conference, right? It's all about experience sharing, best practices, all the walls are down. People are just doing business with people.
Sure.
It's unlike any other conference that we participate in the automotive industry.
Well, this is our first year here. We love it so far. We've been shocked at the setup. We've been shocked at the people, and it's a different place when I get in the elevator to go up to my room and there's open conversations with people I've never met, where most of the time it's head down, phone in hands, let me get to my floor as fast as possible. And ASOTU CON has individuals just absolutely talking and kind of building off that. I'm going to put you on the spot here, so we're going back to that elevator. You get in an elevator with a dealer who has no clue who you are in your company. What would you tell them in the 20 seconds until they get to their floor about you that's different than the rest of the healthcare industry?
High quality, low cost plans, hospitality like service, right? Cost containment and service like Ritz-Carlton, Four Seasons. Things will happen in the healthcare industry as they do. Everybody's had an issue. It's how you resolve it. Follow up, follow through, set expectations, but save money, improve the experience.
So then in wrapping here, I asked the same question. So far, which you got a tough one because it's early on. ASOTU CON, what's your biggest takeaway so far?
My biggest takeaway is you get out of it what you put into it, right? The more you engage with others, the more value, the more benefit that you have. And so, it's coming down early, grabbing breakfast, maybe grabbing breakfast at 3 different tables before the sessions begin. Make sure you're not sticking with the people that you come with. Really get out and meet as many folks as you can, whether they be OEMs or dealers or other vendors.
Perfect.
It's been fantastic.
Keith, if people want to find you here in the next couple of days, where can they find you?
I'll be here on the floor. We got a session coming up at 1 o'clock on healthcare cost containment. It's led by Veronica Ferrari from Atlantic Benefits, Liza Borges, and Ed from Bozeman Ford.
It'll be fun. I'll make sure we check it out. Again, live from the ASOTU CON podcast stage. Sir, we appreciate you joining us. Keith, round of applause, everybody.
Terrific. Thank you, Zach.
Yeah.
Thank you for listening to this ASOTU CON session brought to you by Space Auto. At ASOTU, we're obsessed with uniting people around one big idea, that thriving people are the only path to a thriving and profitable industry. If that resonates with you, head over to morethancars.com to join our email list and explore our full list of podcasts.